What's going on, everyone? Happy Monday to everyone. Welcome back to my channel. Hopefully everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is now time for the Monday edition of the Pandemic Update for Monday, April 29th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and health-related topics in the United States. Want to stay informed what's going on with all these different viruses, including COVID? Subscribe to my channel down below. Like the content you see, give it a thumbs up, share this with anyone you know, and of course, if you have anything to say, leave a comment down below. We just have a couple news stories to talk about today. Some weekly data from B&O. We'll take a look at pollen levels, air quality levels, EMS calls, maybe some wastewater. I don't know if we'll do any wastewater today because we got quite a few things to look at. We got Walgreens, and I do want to take a look at some states that are running above 80% of their hospital patient beds being used. Yes, I did compile a list, and we're going to go back to doing that weekly. We're not going to do a video for it, but we're going to include it maybe in either the Monday or Tuesday edition of the pandemic update each week, because I think it's important to raise awareness of states that are using over 80% of their patient beds. And of course, we'll also take a look at some CDC data, New Jersey and New York. All right, starting off today. Actually got some good news here. COVID booster shots. If you got one, it is linked to 25% lower odds of long COVID. People who received the COVID-19 booster vaccine had 25% lower odds of having long COVID than their unvaccinated counterparts. Now, I will say this, even though it lowers the risk, it still doesn't lower it down to 0%. If you test positive for COVID, even with having a booster, you could still go on to develop long COVID. And for my friends that will leave a comment down below, I like to remind you of this. Remember, long COVID started when COVID started back in 2020. We did not have COVID vaccinations back in 2020. So long COVID predates, started before the vaccines came out. Okay? All right, moving on to this next piece. And yes, we're just going to go right into it. We're going to take a look here at the latest numbers from the B&O on this week's COVID levels. And the U.S. weekly update shows that there were new cases, 54,619 estimated cases. The average is 64,168. That's down by 7,000. States reporting 50 out of 50. In the hospital, 5,865. That's down by 881. In the ICU, 1,066. That's down by 27. 624 new deaths. That's still over 500. The average is 764. That's down by 144. And when I say 50 out of 50 states reporting, they will explain why down below. They usually do. The breakdown for this week's case numbers is actually a little bit different. The reports are from 26 states. The estimates is from 24 states. I seem to recall that used to be 28 states that actually reported. So we lost 2 states. We gained 2 more states that you have to estimate. This week's total cases are down 15% from last week. COVID indicators are declining across the U.S., similar to the same period last year. This trend is expected to continue until a new wave begins, and we'll have a little bit more about the possibility of a new wave, or what the future holds in just a few moments. During the past week, 5,615 Americans were hospitalized with COVID, down 12% from the week before. Good thing. Nearly 6,000 people are currently hospitalized. Not good, but hey, that number is improving significantly. This is the 41st week in a row with more than 500 new COVID deaths in the U.S., or 56,954 deaths during the same period. They also state so far this year, more than 3.1 million cases of COVID have been reported in the U.S., causing 271,780 hospitalizations. So those are the numbers in the last week. What do the future numbers hold? Well, another model just came in. This is Mike Horger, and he did post his update. Remember, recently we took a look at a model from Jay Weiland? Well, now here is another model which estimates what's going to happen with COVID over the next several weeks. Transmission continues to decline. About 1 in 161 people in the U.S. are infectious, the lowest level since July 1st last year. Transmission levels are higher than during 27% of the pandemic, but a good time to catch up on delayed care. Let's take a look at this graphic here. You can see here, when you take a widened view, right now, levels, they're pretty low right now. You can see we've had several periods that were much higher than this. And you can also see here on the right, the 6-month view. It's projecting that there's going to be a slight bump in the road. It's going to go up slightly. Kind of similar to what we saw happen back in the end of January into February. And it doesn't really rise that much. We'll get up to, it looks like, maybe wastewater levels will go to around about 483,000 cases a day down the line. Right now, the current estimate is 296,000. It's an increase, but it's not a major increase. And I also don't know what region is going to cause the most of that. I think it's just a blend of the entire United States. So again, like what we saw the other day with Jake Weiland, not expecting a big increase. Personally, what I think is going to happen, maybe we'll see just a small bump in the road. And if we have to watch for another wave, probably could be something similar to last year where after 4th of July, maybe something happens. And again, I don't know what variants are going to be in the pipeline at that point in time, but we can see currently things are not doing all that bad. BioBot, by the way, did update today. This is reminding me that. So we'll take a look at that too in just a moment. Pollen levels. They are in the red for much of the Northeast and the Mid-Atlantic region, even back across the plains. They are in the red. Today, 32% of the country is in medium to high status for pollen levels. So if you're an allergy sufferer, take those allergy meds today. Air quality levels across the United States, I have to refresh this because it goes gray about every 3 to 5 minutes. And take a look at the air quality levels. Yeah, moderate to yellow across much of the Mid-Atlantic into the Northeast. At least southeast of the I-84 corridor in Connecticut, straight down the I-95 corridor, Bridgeport, Connecticut, New York City. Yeah, your air quality you're definitely in the orange today. There's a few yellow spots east of Ohio, in Ohio. Texas, you have a few yellow spots, and the typical hot spots out in California. EMS calls, a little higher than I would have liked to have seen them yesterday. 787, definitely much busier than the previous Sunday. One factor could be, it's getting hotter here in Philadelphia. It's 90 degrees today. Yesterday did reach into the mid-80s. There could have been an increase in breathing difficulty calls, maybe even dehydration. Didn't really have time to listen to the EMS calls yesterday, but yeah, 787 calls yesterday. Definitely busier than the week before. Live looking at Montgomery County shows that we do have 10 total calls. Choking, rescue, don't know what that's about. Cardiac emergency, diabetic emergency. Chester County, it still is very busy right now. Quite a few fall and lift calls with a few respiratory calls as well. Not seeing calls for dehydration on either, so that is good. And look at that. Live, it just happened. Another respiratory call popped up. So that's now 3 respiratory calls. Sick person and falls and lift assist shows up many times. All right, Walgreens this week. We got a note about this. This is a really good note. Walgreens this week is 12.6%. The prior week was 13%, down 0.4%. Testing is also down. So take a look here. You can see here. We're going to take a look at this chart. We're going to zoom it out. And we can see here, current week's testing is 3,941 with 12.6% positivity rate. But I got a note here that let's go back here. So the current week's positivity rate, the last time that has happened is on April 17th. Let's see, can we pull? There it is. April 17th, when the positivity rate, this is 2022. April 17th of 2022, the positivity rate was 11.6%. It was going up at the time. There was a spring wave. And that was with 189,483 tests. This is the lowest we've had since then. Again, only, well, it says here 4,596 tests, but up here it also says 3,941. You get the point. Testing is way, way lower. And here we are with the positivity rate lower. I think that's some pretty good news. I know there's not a lot of testing going on there. We would look at a few states, but we have a lot of other things to look at. We'll look at some states tomorrow. I have to refresh this. We're going to take a look at the new COVID wastewater levels just in from Biobot, and that should show levels dropping in all regions of the United States. Look at this. All 4 regions of the United States, the Northeast, the Midwest, the South, the West Coast, are equally dropping still for COVID. That's some really good news. All right, moving on now. We have to take a look at some hospital capacity data, and I don't want to get ahead of myself. Well, you just saw what the end of this is going to be. But the end of this hospital capacity, first off, on my list, we have to take a look at Maryland, because Maryland's levels are over 80% at this time. Inpatient bed usage in Maryland, 84.2%, 1.1% is for COVID, 0.2% is for influenza. We would expect influenza to continue to drop. The ICU situation is a bit better, 68.6%, 1.1% for COVID-19, 0.2% for influenza. Maybe we should do an edition of this one day where we find all the places that have ICU usage over 80%. Massachusetts, unfortunately, you're one of them. 82% of ICU beds are being used, 1.1% for COVID, 0.8% for influenza, and your inpatient bed situation, yeah, it's still bad. 86.6%, 0.9% for COVID-19, 0.7% for influenza. Next on our list, believe it or not, is Minnesota. Check this out. In Minnesota, currently 81.8% of all beds are currently occupied, 0.8% for COVID-19, 0.5% is for influenza. The ICU situation in Minnesota, a little bit better. 76.4% of ICU beds are being used, 0.6% is for COVID, 0.6% is also for influenza. Then on my list, next comes Missouri. And in Missouri, the ICU situation is 79.2% of ICU beds are being used, 1% for COVID, 0.4% for influenza. Taking a look at the inpatient bed situation, you are at 83.1% of all hospital beds being used, 1% for COVID, 0.5% for influenza. Nevada, yes, you do make the list. In Nevada at this time, we can see the current situation shows that 80.9% of all beds are being used, 0.6% for COVID, 0.3% for influenza. When we take a look at your ICU situation, yeah, look at that. It's starting to go up. 75.3% are being used, 0.6% for COVID, 0.3% for influenza. That's below 80%, but again, it did see an increase in the past week. New Hampshire, yes, New Hampshire makes the list as well. In New Hampshire, the ICU situation, not too bad. 67% of ICU beds being used, 0.9% for COVID, 0% for influenza. That's good to see. Inpatient bed usage at this time, 80.4%, so you're just over 80%, 0.7% for COVID, 0.3% for influenza, and Rhode Island. Rhode Island always seems to make this list, and here comes Rhode Island. Let's see, where are you at this week? Rhode Island is at 86.6% of beds being used, 0.6% for COVID-19, 1.3% for influenza. How about the ICU situation in Rhode Island? Well, that's actually down. It's down to 79.8%. 1% of that's for COVID, 0.6% is for influenza. Washington, yes, the state of Washington does make the list. Your ICU situation is at 79.6% being used, 0.5% for COVID, 0.2% for influenza. Inpatient bed usage at this time in the state of Washington is at 84.4%. COVID makes 0.9% of that. Influenza is 0.3% of that. And finally, West Virginia is on the list as well. Yes, your hospital situation, it just went over 80%. It's at 80.1%. COVID-19 makes up 0.8% of that. Influenza makes up 0.3% of that. But which state is doing the best? Might you ask? Well, actually, if we would continue down to Wyoming, check this out. Inpatient bed usage in Wyoming is at 44.9%. That's pretty good. You're doing pretty well. You're doing really well. 0.5% of that's for COVID, 0.1% is for influenza, and ICU situation there. That's wow. 37.7%, that's it. You're only using 37.7% for your ICU beds, 0.2% for COVID-19, and 0% for influenza. Your hospital capacity situation in Wyoming is pretty good. All right, moving on now. Let's take a look at some COVID variant data. And the COVID variant data shows that KP.2 is 24.9% of the cases. JN.1 is at 22%. JN1.7 is at 13.7%. Then you have a whole bunch of other variants that are below 10% at this time. Again, we are back into variant soup. Flu's not doing too bad. It's moderate in North Dakota, and that's it. It's just low or minimal everywhere else. New Jersey, once again, we don't have a lot of hospitals reporting from New Jersey. Just 57 out of 70. I will read the data. 158 hospitalizations, 8 people on a ventilator, 28 people in the ICU, 22 discharges at this time. Taking a look at what is going on in New York State, and I do need to refresh this. Let's see, I think that's the correct number. Yeah, 422 people have tested positive. Does not include those at-home tests. And refreshing New York State hospitalizations, just to be sure we get the most up-to-date number here. And we can see in New York State, hospitalizations dropped again. 411 people in the hospital, 44 people in the ICU. I'm very hopeful and confident New York State can get below 400 this week. That would be fantastic. Get New York State below 400 hospitalizations. That would be great. Alrighty, folks, that does it for the Monday edition of the Pandemic Update. I hope you learned something. Did your state make the list for hospital bed usage being over 80%? Remember, I consider personally any state that's over 80% or even 85%, you got a problem. If another pandemic should crop up, that's quite a bit of beds being used. If your state didn't make the list this week, who knows? Maybe it will next week, or maybe your state will fall off the list next week. We'll do that again next week, and we'll do another pandemic update again tomorrow, where we will dive deeper into Walgreens states. I'm sure we'll have some other news, and we'll do some wastewater sites that we did not get to yesterday. There are some states in the South that we need to take a look at. We'll do that again tomorrow. If you like this video, give it a thumbs up. Got anything to say about today's video? Leave a comment down below. Want to subscribe? You feel like you just got educated with what's going on? Maybe you never knew your state was using so much of its hospital capacity. Subscribe down below, and of course share this with anyone you know. I will see you all again next time. Until I see you again next time, stay safe everyone, and have a fantastic Monday evening, and thanks for watching.